Hello, my name is Daniel Stillwell. I am the editor of the IFTA e-newsletter, and we have with us today Reyna Mejia Kot. She is a PhD student at Loma Linda University, and she is one of our student award winners for the IFTA Congress for the presentation, The Psychological and Relational Impacts of Colorism, a Quantitative Study of Latino Adults. Thank you so much, Reyna, for being with us today.
Yeah, my pleasure. I'm so honored to be receiving this award. It was quite unexpected when I received the email. It took me by surprise, and I just felt so honored.
Fantastic. Well, we always like to highlight people doing good work, and it seems like you are absolutely doing that. Um, I like to start off with sort of an professional identity question to all my people. We have people all over the world who do all sorts of work in different settings. In your setting, or maybe the setting that you conceptualize yourself, what type of clinician do you identify as? Like, what terms do you use, and what does the work actually look like?
Yeah, so I identify as a trauma-informed relational therapist. I work with individuals, couples, and families in private practice. I also work in a community-based setting where I support individuals who have been impacted by sexual assault and domestic violence. In that work is where I witness how profoundly trauma affects the nervous system, safety, and that capacity for connection. And so clinically, I'm vastly interested in neurobiology and interpersonal neurobiology and how all of that affects relationships and the person holistically. And so my work really focuses on supporting individuals regulate, feel safe again, and to have that capacity to connect with others. And that really encompasses where my focus is.
All right. And you're not just a clinician, you're also a scholar, and now you're getting a PhD, so you're doing research. So how do you, what other kind of hats do you wear?
Well, those that you mentioned, I am a researcher. I'm a new researcher, and this is the work that really tied everything in.
Hmm.
I pivoted careers into mental health, but everything that I've done prior to leading me to this point has really reinforced who I am as a clinician, and really also the work that I am doing in academia and with research. So those are the hats that I primarily wear now, where I am in my life.
Okay. And one of the projects that you have done is one that we're highlighting today. So tell us a little bit about the psychological and relational impacts of colorism.
Yeah, I also want to give credit to my faculty mentor, Dr. Alemi, who I am working on this project with, who has really been instrumental in this process. He's been such a support to my colleague, Nikita Banjera, and myself. And so together we have been working on this project. And this work that I'll be presenting on, the psychological and relational impact of colorism among Latino adults, is really to delve into how this has an impact on the individual. So, colorism refers to the discrimination of others or differential treatment based on skin tone. And even within individuals in the same ethnic or racial group. And so, this is seen throughout the world. This isn't something that is limited just to Latinos. So
Mhm.
society tends to prioritize, privilege and also by dominant beauty standards or shades. And this is something that family therapists see worldwide working with individuals who have been impacted by these hierarchies.
I would imagine that some of our listeners or viewers around the world are familiar with colorism, some are not. But how does this different from different? How is this different from racism or ethnic differences in how people get treated?
Yeah, colorism is specifically based on skin tone and shades. So in our quantitative study, we did also have, part of the that we measured this, some of the scales that were used also had people look at different shades of skin tone in order to connect and how they were treated within the family or in work environments and in social environments. So we're looking at this not only on an individual or relational level, but also systemically. And where it really differs from racism, colorism focuses on appearance. It's more of an external thing. And so that's how it really differences. And that's where it's nuanced.
Yeah, because I wonder if a lot of people actually are enculturated in a coloristic way, but kind of use racist terms for what they're describing. That it is in fact an external, superficial assumption that then goes deep instead of something that's more cultural or ethnic or something like that.
Right. And you know, you mentioned culturally, right? And so culturally in caste systems and also colonial legacies,
Mm.
it's also prioritized by shades of skin.
Mm-hmm.
And so we do see it where it is on an external level, but also culturally, these individuals tend to be prioritized based on certain shades. And so we're measuring the impact on self-esteem, identity development, on depressive symptoms, and so also the everyday impact of colorism that people deal with day to day.
Okay. So you have a study that you're going to be presenting. Any takeaways or findings or maybe helpful suggestions for other therapists?
Yeah, so what we hope to really provide other clinicians with is the capacity to work with a cultural humility, cultural humility approach and also relational approach to the study. At my presentation, I will be sharing preliminary findings to the impact. So you're going to have to attend my session so that you can hear more. But I'm really excited as this comes together. Our sample size was something that we were really proud of. We had 150 participants. So yeah, and for being a new researcher, we're really excited about this outcome.
Very nice. Um, okay, so this is not the only presentation you're going to be giving at IFTA. Tell us a little bit about the other one.
Yeah, so my second presentation that I'll be presenting at IFTA is the utilization of EMDR in couples therapy. This is something that I'm quite passionate about as well. I have been utilizing EMDR. I'm a trained clinician in EMDR, and I really have seen how it has supported individuals who have been impacted by trauma. And when I work with couples in which is a different capacity, these couples are coming in with trauma that hasn't been addressed, and it's showing up in their relational patterns. So whether it's communication, which there's other modalities that are so wonderful out there as well, but they're not working with the trauma. Then sometimes it seems it's more on the communication patterns or how to hear the other person, which of course is all relevant and important and essential in a relationship, but we're not getting to the core of what's happening with the individual and how it's being brought into their relationship. So with integrating EMDR into the couples work, which I've started to do in my work, has really been life-changing for many of my couples. They've been able to access empathy that was never there, to have an understanding for how some of these relational patterns had nothing to do with their partner, but instead with the history and experiences that they've been through from their past.
Okay, that sounds very powerful. I'm familiar with EMDR, but maybe not everyone is. Can you do a 40-second synopsis of what it is and how it works real quick?
Yeah, EMDR is eye movement desensitization reprocessing. Wait, I just butchered that. Eye movement desensitization and reprocessing. Sometimes it's a mouthful.
Yes, that's why we say
Uh,
EMDR.
yes, exactly. That is why we say EMDR. Gosh. And so EMDR focuses on bilateral stimulation and working on specifically with the part of the brain that has been affected with trauma, which is a triune brain. So really working on having logic and emotion communicate again, because there's certain parts of the brain that have been offline. EMDR is more structured, where it is focused on it's an eight-phased modality. And we're working on desensitizing the individual from a negative cognition that is connected to a target memory. And through that process, you work on installing an adaptive response for the individual. And that also transitions into other memories and so on. And so you can continue to work on memories. It really is a beautiful modality developed by Francine Shapiro, who, again, I am really a big advocate of the modality and integrate it into my individual work as well.
Hmm.
As I shared earlier, I work holistically with the individual and how this has impacted the nervous system, and the mindfulness that is also incorporated into this modality is really helpful.
And that was an excellent synopsis of what it is. And I think it dovetails into the couples work really nicely because even if somebody didn't know about it, I think they can launch with you, what you're saying. Do you end up treating more traumas that are predating or sort of an individualized trauma that predate the relationship, or are these often traumas that happen from one to the other?
A little bit of both.
Okay.
There have been some individuals who have come in with infidelity and they're working through infidelity. And so that's going to require a different type of level of processing. So there is a lot of assessment that goes into before going into the work with EMDR and bringing it into couples work. There has to be a sense of safety. So as I mentioned, those phases, right? Phase one is clinical intake. Phase two is resourcing. So the resourcing is really installing the coping skills for individuals to be able to go into processing this trauma. So we spend a substantial amount of time in phase two, preparing the couple to go into that work if that is something that they would like to do together. There's also a few ways how it's been used. And so when it's a shared trauma, we'll use a car accident, for example, we can apply dyadic stimulation.
Hmm.
And dyadic stimulation is the best way to where both couples are applying that dual attention stimulus at the same time, whether it's tapping, doing it themselves. And other ways that it's also been used is with the individual witnessing the other person's process with EMDR, which is really great for that empathy and
Hmm.
compassion to develop that maybe sometimes some couples can't access.
I think witness is a fantastic word for that because that's it. Yes, sometimes it might be doing individual therapy with somebody
Mhm.
as a witness, but that itself cannot be discounted for what that means for the relationship.
Right.
How do
Right.
you make sure that it doesn't get imbalanced in terms of attention or in terms of therapeutic processing?
That's a really good question. And well, where we have to ensure that it doesn't get imbalanced is a lot of checking in.
Okay.
So a lot of checking in with the individuals. In my experience, as I've been using EMDR in couples work, there's a lot of patience that is also developed in this process. So I'm not really focusing on the imbalance in these moments, but really what's happening within the unit.
Hmm.
And that's been really supportive to the process.
Okay. Are there relationally specific metrics that you look for in terms of things are getting better? Or do you tend to look at some of the same physiological or psychological metrics that you would for individuals?
A little bit of both. Also using these scales, to measure where communication is, where also where compassion is within the relationship. So these are things that are specific to the unit. And then we are also measuring, I'm looking at anxiety and depressive symptoms. And so there's a lot to consider. There
Hmm.
are some implications. We don't want to work with someone who is in an active domestic violence
Sure.
relationship. So there are some things to also assess for. But yeah, that is some of what we look for.
Okay. All right. Um, this is for an international audience. Are there any sort of takeaways or things that you think could be applied to this across cultures or even with couples where you have interracial or intercultural dynamics themselves?
Of course, of course, this is a trauma modality. So trauma really is can be applied exactly across any type of culture. So this is where this is really useful. I know that EMDR is used also worldwide. And this is something that interracial couples, I have used this with interracial couples because there's this lack of understanding to how certain couples or how an individual has been impacted by
Hmm.
also the day-to-day experiences. So where the other individual doesn't fully understand the process until, again, go back to that word, they witness what their partner has gone through and where they are.
Yeah. And that goes back to the cultural humility piece of,
Mhm.
I mean, how much couples work is just simply getting them to slow down and check their assumptions and hold space for the other. And this is a great way to do that.
Yeah, exactly. And it's just doing it in a slightly different way.
Okay. All right. Um, Anything else in particular about your presentations that you want to share with the audience?
I'm really excited about both. My first presentation that we talked about, the psychological and relational impact of colorism among Latino
Mhm.
adults, stems from my background as a first generation Mexican American. And also my connection, my PhD is focused on systems, families, and couples. So that ties in quite nicely. And I am born and raised in Los Angeles. And so this is something that I've been exposed to many diverse cultures, and I have seen it and been exposed to it, maybe experienced it as well. And so that is where that stems from, that interest. And my utilization of EMDR and couples therapy is connected to my dissertation.
Mhm.
And that's my focus will be on expanding and developing a protocol for EMDR in couples work.
Wonderful. Well, I appreciate getting to meet you and getting a chance to talk about some of your work. I'm looking forward to meeting you in person in Norway in a few weeks. So, future Dr. Kot, thank you so much for joining us today, and we'll be seeing you.
Thank you so much. And thank you for your time. It was a pleasure meeting you as well. And I can't wait to meet you in Norway.